Hello, this is Michael George of Sagesse Healthcare Consulting, and this is the Pioneering Patient Podcast. Today, my guest is a 28-year-old newly qualified medical doctor from Crete in Greece. But we won't be talking to her about her medical career. It will be about her experience of 20-year experience of living with type 1 diabetes. So Konstantina Boumaki, welcome to the podcast. Thank you for joining us.
Thank you for inviting me.
So let's go back to the age of 9. You were a really energetic young child. You're energetic now. But things changed suddenly. What happened to you at that time?
So for 3 months, I was losing a lot of weight. I was losing my energy. I was very pale and I was drinking a lot of water and I was very hungry but was losing weight. But because I was a very tall girl, my mom was thinking that I was getting taller. So she got an advice from my pediatrician, but he said like everything is going to be fine. And then we were at the birthday party of a family friend, and the mothers there, they knew me well, so they said to my mom, you need to take her to the doctor because she seems off. I couldn't understand what they were telling me because I had like hyperglycemia for many months. And then she took me to my pediatrician who luckily had done a seminar for the smell of ketones in the breath because I was in ketoacidosis because of the constant hyperglycemia. And he said to my mom immediately with diagnosis, like you need to go to the emergency room at the hospital with a type 1 diabetes diagnosis.
Mm-hmm. And so you went and you got that diagnosis. So what happened then? Life turned around in the next week or so?
Yeah, like immediately life changed, not after a week, because since the first day I needed to have an IV on me with insulin to control my blood glucose, and then we were doing the education of what I needed to do because my whole life changed, my whole routine in everyday life, and we needed to be taught in this new routine. But thankfully I was a routine-oriented child, so I adapted well, but my only concern as a 9-year-old was if I would be able to eat my chips on Saturday, which my doctor said yes. So that was my first positive.
That reassured you, because for a lot of patients, diabetes patients, you hear that it's quite a traumatic thing to be diagnosed. But what was that like for you and why was it perhaps different for you?
Yeah, so I was lucky because my pediatrician had done this seminar. So usually, and back in the day, I was diagnosed in 2005. And especially, I grew up in Crete, in Greece, which is an island. It's not in Athens, so it's not a big town. It's big for an island, but it's not big generally. So no one really knows about the symptoms. No one really knew about what diabetes was, even type 2, you think it's like your grandmother's disease or your grandfather's disease. So you don't think that a child can be diagnosed. So thankfully my doctor had done this seminar and we immediately got diagnosed. But usually what happened back in the day, but still in many countries, mostly low-income countries now, the child gets in a coma because it's not diagnosed. You keep have hyperglycemia for many months, which is very bad for your health and your body, and your body then gets into a coma because it's not able to have the glucose in the muscles or in the brain, so it's not treated well.
So getting your diagnosis when you did actually could have saved many worse consequences, is that the case? It depends on the timing.
So I might had for 3 or 4 months slowly hyperglycemia, like my blood glucose was going up, and I had constant hyperglycemia, but I was diagnosed early, so that played a huge role. Imagine a child being in a coma for some days and then waking up, not being able to understand what it has. It would be more traumatic for me. Yeah.
So I'm going to ask you two questions. One, in your role as a medical doctor, the next as a patient dealing with it every day. So could you explain, in your role as a medical doctor and a patient, the difference between type 1 and type 2 diabetes?
Yeah, so I want to mention that it's not the only types of diabetes. There are many types, as gestational or Mondi or LADA, there are many. But the most known are type 1 and type 2. So type 1 is autoimmune, so your body attacks the beta cells in the pancreas that produces the insulin, and it can start as a mellitus phase that it has destroyed some of them, but it keeps producing some insulin. But then slowly, it might take years, or in some child's months, the whole beta cells are destroyed. So the body can produce insulin. It doesn't have the cells to produce the insulin. So then you need to take the role of the pancreas. But in type 2, so I don't want to get a lot into that because there are specific types. Again, it might be that the pancreas is tired, so it doesn't produce a lot of insulin, although the cells are in the pancreas. But sometimes it produces, but the body, because it's so used to the insulin, it has a resistance, so it doesn't absorb it. This is very simple. It's more complicated, but this is as simple as I can explain it. Yeah.
That's good. And then coming to your managing your daily life with diabetes, you've had to be very disciplined managing it. It's not simple. There are 42 factors, I understand, which kind of impact upon you. So tell me more about your life managing your diabetes daily and what you use for that.
Yeah, so it changed through the years because there are many systems, and of course back in the day we don't have the systems that we have today. So when I was diagnosed, I had the mixed insulin system, which was syringe system. I was doing shots, and because it's a mixed insulin, I needed to have exactly grams of food every 3 hours, specific diet, not to be able to eat something else every day, once per week or like 10 days, but in a small portion. And just because I was a child, usually you're not able to even eat those. So I was a very thin girl and I wasn't hungry at all. And sometimes my mom was saying that you need to eat that because you have to, otherwise I would be in hypoglycemia, and this can lead to a coma too. But then after I had the issue with night hypoglycemia when I was sleeping, because it's specific doses, you can't really adjust it. So after that I went to the pen system, but again I had issues with the night hypoglycemia. My body is like that. Every person is different, so this is my personal experience. Some others don't have this issue, but the nights were the most difficult for me. So I requested a pump, which back in 2011, which back then was only for the people who weren't controlling it well. I was controlling it very well, but I had this issue and I felt that I wanted to try it. Yeah. So when I tried it, everything changed, because you can, in the pump, you have only the short acting, so you can say every 1 hour if your body needs more insulin during noon, but less insulin during the night, then you can adjust it every 1 hour to your dose that your body needs. And that was the solution for me. It was the best system. Yeah.
So I think we'll have a look at the pump.
Now I'm wearing the pump. It's the newest pump which has a closed loop system. And I'm wearing a CGM, which is a continuous glucose monitor. So yes, and it's connecting, and depending on my blood glucose, when I miscalculate a lunch, because we need to calculate everything we eat, the carbohydrates that the food will be consuming, yes. So if I miscalculate a food because I'm traveling and I don't know the correct dose, then the pump will do some small corrections to adjust it accordingly.
Yeah. So it's quite a very complex life for you. And how does that impact upon your relationships, your daily life with friends and families?
So, like, through the years, when I was diagnosed, because no one really was talking about diabetes, but I had this justice system. I felt that I needed to speak about it. I needed to raise this awareness. And but because no one really knew, I didn't want to be stereotyped or discriminated or to think that I'm different. So I was under-presenting it. So I was saying that everything is fine, I just need to do my insulin and that's that. Yeah. But slowly I was realizing that this created a huge gap between even my friends, because I was showing something that it's not true. Yeah. Diabetes life is hard, and you need to do so many things, and some days things don't go as planned. 42 things out of my control can affect my blood glucose, like hormones, the weather, if I'm stressed, everything anyway. So these were not discussed between my friends and I. So if I had a bad day because of that, and I couldn't do anything about it, and you have symptoms when you have hyperglycemia or hypoglycemia, and if you have huge ups and downs, I couldn't really say, today is not a day, so I don't want to go out. I didn't want to show this
vulnerability.
Yeah, I can't pronounce this word. Anyway, so I was just constantly neglecting that, but it wasn't a true relationship between my friends and I. So it created a huge wall. But now I am discussing more of these, and my friends can understand. They can really feel or really know what I'm going through, but they understand that they can give me space or they can help me in any way they can, and it's better now.
And your brother, I think you have a very good relationship with him, but that could sometimes be a difficulty when you were younger.
Oh, so when I was younger, I had my teenage years were very hard because of all these issues that I hadn't accepted between my diabetes life and myself. But you have the hormones of the teenage years, so it was like all combined, and and my family was the people that will never stop talking to me, right? So I couldn't being angry to my friends for no reason, so I was angry to my brother or my mother. Yeah. Thankfully, they still talk to me. So
that's teenage years anyway. That's quite normal. Now, there's someone, the family was important, the team was important, and you had a mentor who's been very important in your life, the Dr. Boumaki,
yes,
who's really been important and put you on the road to also become a doctor and made you the poster child of diabetes in Crete. Tell us more about that relationship.
Yeah, I will talk, my doctor is the best, but also I want to mention the family because it's usually neglected. And the family played a huge role. My mom was struggling at first because her life changed too. She needs to take care of my health because I can die in any minute. Mm-hmm. But, and I was a 9-year-old, like how can you be so responsible for a 9-year-old when it's at school? How can you control that? So she was very struggling, but she never showed it to me, so I didn't know. And this positivity and this yes, you can do everything you want, or your diabetes will not be an issue and you can share it with everyone. This put me into this advocacy work because she was open about it. She was fighting with me, alongside me, and my dad. In any way to help me, and of course my brother, my #1 supporter still. But this support is very needed, and when you are a child that you're still figuring out who you are generally, and you're diagnosed with this disease that needs constant care, and you lose your childhood from the day one of your diagnosis, it's like a whole different life. You need to be responsible of your health. Your family plays a huge role for this support, to not feel alone. Mm-hmm. Yeah, but the doctor played a huge role too because He was a great educator. He was great in communicating everything. He was great in showing me the way of controlling it good, to solve the things. I had a lot of hypoglycemia, and my mother was like, don't know what to do. She might call him at 2 a.m. and he was picking up the phone because, of course, he had said, you can call me at 2 a.m. It's not that my mom is, stepping into the, no. But he was there and he was so helpful, which the first few months played a huge role. And after that, because type 1 diabetes needs constant care with and constant relationship with your doctor. I was going every 3 months for checkups because you need to see if you're growing up good, if you're eating good, and if the body reacts good, if your weight is okay, if your height is okay. So he was very supportive. And because he saw that I was very open in communicating my disease, because it wasn't often, he put me into the advocacy work. And my mom, he put her in the local association. He introduced her to the board, and he got into the board for like over 10 years. She was there and very active. And he was taking me to interviews with him to speak about diabetes, to show that this is a child and she has diabetes and this is normal. You can see many people, and yeah.
And he's also put you on the path to becoming a doctor, I understand.
Yes. He was saying that, oh, you will go into medicine and you will take my place. But yeah, I'm not sure about that. He's retired now, so someone else has his place.
Perhaps in a few years.
Yeah.
So you moved on from supporting the local group, your mum supporting that group, to working with the International Diabetes Foundation as a federation, as a young advocate. Tell us more about that.
Yeah, so when I was 18, I went to the IDF Europe, IDF is the International Diabetes Federation, camp, which was a youth leadership camp. It was my first connection with a European level organization, meeting so many people from other countries and discussing our activities and our advocacy work, even though I didn't know what advocacy was because we don't have that word in Greek. But this group was so inspiring. Like, everyone are still very inspiring people, leading in the advocacy world, leading everywhere they do. They are still very active in the diabetes advocacy. And that's why I think I got more involved, because they were all older than me, not so older. I mean, it's a youth leadership camp, of course. But they have done many more things than an 18-year-old. So after that, I was involved with the IDF Young Leaders in Diabetes program of the global IDF. And I became a mentor there. I started, you're learning a lot of things. It's like a training program. And then you're organizing and creating a project in your own country, which we did with my local association, the Pancreatic Association for Juvenile Diabetes. And it was so inspiring hearing all these stories, because I first only knew the problems in Greece. Then I went to the youth leadership camp and I knew the problems in Europe, comparing to East Side or West Side Europe, because you have different healthcare systems. But then when you meet people from Africa or Middle East or Asia, that they have lack of access in basic needs, you're shocked. You say, so what is my advocacy work? To just raise awareness or to minimize the stereotypes, which is so important. But imagine if a person has no access to anything for their health, because we need insulin to live. Mm-hmm. And some people, they don't even have this, which is sad. And that inspired me to get into the policy side of advocacy, which I'm active now. I'm involved in many organizations and in the boards and
European Patient Forum, for instance.
The European Patients Forum and the Hellenic Diabetes Federation in Greece, to speak with the governments, to create new projects, to create new systems, and to fight for for patients. Yeah.
So if I was asking you, what are the two or three things you want to campaign for a diabetes patients, what would those be?
So I think equity. Equity is the number one thing that it's much needed now. Equity in the technologies, in the access to healthcare, in the access to education. So equity involves everything because some countries are more benefited than others, and this is not right. This is not how it's supposed to be. The accident of you being born in one country or another shouldn't suppose if you live or not with diabetes, and to control how you live. So this is the number one priority, but also because I still live in Greece and the stereotypes and the discrimination still exist. This is another topic close to my heart because I'm very close to these issues and my local community, of course. Yeah.
So if you were to speak to someone now, it's a 9-year-old child like yourself, who's facing up to being a type 1 diabetes patient, what advice would you give them? What advice would you give them to yourself in those days? And what advice would you give them to them now?
That there will be good and bad days, and it's not your fault. Because a lot of times you blame yourself, like, what did I do wrong? I need to calculate better. But no, there are so many things that can affect your blood glucose that it's out of your control, and you're doing amazing. And you need to keep trying to control it, or to just keep trying to live. And you're going to be great.
Thank you. Konstantina, thank you for sharing your story. Thank you for the great advice you've given. Thank you for joining the Pioneer Patient Podcast.
Thank you so much.
Thank you. Thank you. That brings us to the end of this edition of the Pioneering Patient Podcast. If you've got suggestions for guests for future editions, please contact me on the email that we'll leave at the end of the show. And so thank you for joining us, and remember, take good care of your health.